Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this video, I'm going to be doing a continuation of my last two videos that I've done in the last 2 months, talking about my personal experience with Bupropion, or Wellbutrin. So far, I've done a video at the 1 week mark, and also at the 1 month mark. Now, before I get into the kind of review, per se, I just want to talk about something I mentioned in my last two videos, in that with most antidepressants, there's kind of two things you really have to factor in terms of how the medication's working. So the first one would be the efficacy, or how effective the medication is. And unfortunately with antidepressants, that kind of starts off slow and then gradually increases over time until around the 1 or 2 month mark, where you really reach that maximum effect. Now the other thing to consider is side effects, which seem to happen early on and then taper off with time. So I mentioned in my 1 week video that I was having a lot of side effects, a lot of anxiety, dry mouth, a rapid heart rate, and they kind of tapered off around the 1 month mark. And now being at the 2 month mark, I'm really not having any side effects at all. The only side effect that kind of still persists would be anxiety, but I find this only happens when I increase the dose. So after 1 month, I increased from 150 milligrams to 300 milligrams, and again experienced anxiety for 4 to 5 days afterwards. And recently, I increased at the 2 month mark, about 2 days ago, I increased from 300 milligrams to 450 milligrams. So again, the anxiety is kind of back a little bit, but it's not as severe or troubling as it was at the 1 week review that I did. When I first started the medication, the anxiety was much worse. So overall, I'm pretty confident that over the next week or two, I won't be experiencing any side effects at all. Now, the other thing to talk about would be my mood, or my frequency of depressive thoughts. So the first thing I'll say is, during this whole experience, going from just starting the medication all the way till now at the 2 month mark, it definitely wasn't a linear curve of kind of like decreasing negative thoughts. It was kind of staggered. Some days I would have a good day, then the next day I might have a lot of depressive thoughts. But overall, the trend was positive in that the longer I was on the medication, the less depressive thoughts I would have. Again, just some days I would kind of dip back down and have those depressive thoughts, but overall it was trending in a positive direction. One indicator that I know that this medication is really working for me is that I actually used this medication last winter, but I didn't start it last year until October 31st. This year I started it September 17th. And the reason I use it this time of year is because with my bipolar disorder, it seems like this part of the year, this winter time, when the clocks go back and it gets dark early, that's when my depression really seems to set in. But I know that it's working for me because when I compare myself the way I feel now compared to this time last year, it's a world of the difference. Last year at this time, I had suicidal thoughts, suicidal ideation, trouble getting out of bed in the morning, a lot of physical symptoms of depression, and my negative thoughts were really racing through my head. It was hard to get control of them. But now, this time of year, after being on the medication for 2 months, I'm kind of back to myself. Like, here I am making YouTube videos. I'm exercising daily. The negative thoughts aren't as rapid in my mind, and I'm able to kind of not ignore, but kind of focus on positive things when they do surface. Just overall, it's a different experience right now than it was this time last year. Now that I've increased the dose to 450 milligrams, I do still think that there is a little bit of room for improvement. Again, I do feel good right now. Very happy I started taking the medication early, but I still think there's a little bit of room for improvement, just because there are still some days where my mood is decreased and I'm having those depressive thoughts. Again, no suicidal ideation, no suicidal thoughts, so I'm in a good place and the medication has done its job, but I just think there's a little bit of room for more improvement. And I talked with my psychiatrist that at the 2 month mark, or around the 2 month mark, if I felt like it was necessary, I could increase to 450. So it'll be interesting to see over the next month or so if I can really get back to completely feeling normal like I did in July and August. During that time in the summer months, I was feeling great and had no need for an antidepressant whatsoever. So definitely overall, I would recommend this medication for patients with bipolar disorder. The main reason is because it only has a 3% chance of pushing you into mania. I can't really talk for people that don't have bipolar disorder and are suffering from depression. So you may have to look at other review videos on YouTube to get that information. Because remember, with bipolar disorder, my depression may be different from people who have unipolar depression. So just keep that in mind with all my videos talking about this medication. Anyway, that's all I really wanted to talk about in this video, just to give you a 2-month update on how I'm feeling with the use of Bupropion or Wellbutrin. Again, very happy I started taking the medication early, and actually next year I'll start taking it September 1st, just to make sure that I give myself the most chance to kind of get away from that depression that usually seems to happen in October. So as always, I'm very appreciative that you took the time to watch one of my videos. If you'd like to help grow the channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. All right, that's it for today. Take care.